Today, we will start with the first video where we understand the coronary calcification and its treatment options. First of all, we'll answer the question, what is a coronary calcification? Coronary calcification happens when the calcium builds up in the walls of the arteries that supply blood to your heart. This can make the arteries hard and narrow, making it harder for the blood to flow through. When this happens, it increases the risk of heart attacks and other heart problems. If the coronary calcium is in the vessel wall without causing a blockage, it is generally not a problem. However, if it obstructs the blood flow, it can make it challenging to treat the blockage with a stent. How can we deal with the coronary calcification during the stenting procedure? There are several advanced methods to use to treat the coronary calcification. Let us see them one by one. First of all, intravascular lithotripsy. Imagine a tiny device inside your artery that sends out shock waves similar to the one the doctors use to break kidney stones. These shock waves break the calcium deposits into smaller pieces, making it easier to open up the artery and place a stent. The stent is a small tube that keeps the artery open. So apart from the IVL, we can use a rotablation technique where this technique uses a small drill kind of a thing that is called rotablator, which spins at a very high speed to grind away the hard calcium inside the artery. This helps us to widen the artery and place the stent more easily. One more technique is orbital atherectomy. Orbital atherectomy works like a tiny sander inside your artery. It is a diamond coated crown. It spins around and sands away the calcium, making the artery smoother and easier to treat. This method is especially good for calcium that is spread out or forms little lumps where they are called calcium nodules. There are several specialized balloons that can also be used to treat the calcified narrowed arteries. Here are a few types. One is a scoring balloon. These have a small wires on the surface that make tiny cuts in the plaques where it helps to break up the calcium so that the artery can expand easily. Cutting balloons, these have a tiny blades that make small cuts in the plaque which helps to widen the artery, and this also can be used to treat the calcium blocks. The ultra high pressure balloons are also called OPN balloons, and these balloons can inflate at very high pressures, which is useful for really tough calcified areas. So we use all these balloons and these systems to expand the vessel during the stenting. And then we will also use things called intravascular image where we can see inside the artery and guide the treatment. Where we can use the intravascular ultrasound where it uses sound waves to create pictures of inside of the artery. This helps us to see how much of the calcium is there and to decide the best way to treat it. There is another imaging modality called optical coherence tomography where it uses light to make very detailed images of the artery walls. It's like taking a very close-up photo showing exactly where the calcium is and how to treat it. Why is treating the calcium important? Treating the coronary calcification is crucial because it helps to restore the normal blood flow to the heart. By using these advanced techniques, we can reduce the risk of heart attacks and other serious heart problems. At Pulseheart Super Specialty Hospital, we use all these procedures to ensure the best care for our patients. If you have any doubts regarding the calcification of the coronary arteries and the methods used to treat them, please put your questions in the comment section so that we can answer them and get back to them. Thank you, ladies and gentlemen, watching this video, and if you like the content given in this video, please do subscribe to the channel. Thank you very much.